mentioned throughout, arguably if there were one thing that or if there were one of the really important things that we were going to do to change the face of addiction, reduce overdose deaths, help people get better faster, it would be to increase access and reduce barriers to medication-assisted treatment, right? Because it's still a problem in a lot of areas in our country. So across addiction treatment, there's a lot of medications out there that can help with a variety of things. There's two classes of medications, two categories within substance use disorder that are the most evidence-based, where we use medications the most, and they're really the mainstay of treatment. So those things are opiate use disorder and nicotine use disorder. Other addictions, there are certainly medications that can help, like cocaine and alcohol and other substances, but these are the ones that really have the most evidence behind them. So just to review the DSM criteria for opiate use disorder. So in order to be a candidate for medication-assisted treatment, someone has to fit the criteria of moderate to severe opiate use disorder. So three sort of helpful way to categorize the criteria are impaired control, all the criteria that go under that, social, which is functional impairment, failure to fulfill your role obligations at home, school, employment, social circles, and then risky use, so use despite hazardous consequences. Could be getting behind the wheel of a car, could be using in physically dangerous situations, using unclean needles, all sorts of things. And then we have those pharmacological properties of tolerance and withdrawal that we talked about that don't really apply to the substances when they're prescribed, but when people are using illicit substances, we certainly count those as criteria. So that's people walk in the door, we make sure they meet criteria for moderate to severe opiate use disorder, then we know that they're a candidate for medication-assisted treatment. So this goes over the process of the addiction that happens in the brain, specifically for opiate use disorder. So on the right side of the chart, we have someone's mood state. Right at the bottom, we have someone who's really anxious and dysphoric, and at the top, we have someone who's super mellow, super euphoric. So someone starts out, let's say that this person starts out at a euthymic spot. So they're feeling pretty good, there's no baseline depression or anxiety, and they get their first exposure to opioids. That black line shoots them up into the mellow euphoric zone, so they feel really good, then they stop using, they come back down to baseline, right? That's like a one-time use. What we know happens is over time, as people are using to achieve this euphoric state, is that the baseline changes. So those red cubes get lower, lower, lower on the mood state. So the more, when people are first starting to use, they're using to achieve that high, and then as the addiction continues, they're using just to stay out of the dysphoric phase, right? So baseline gets lower, lower, and then eventually we see people at the point where they're just using to feel like sort of normal or not be in withdrawal anymore. So that's psychological pain, that's physical pain, they're in withdrawal, because we know that opiates are not only a really good physical painkiller, they're also a really effective emotional painkiller. So people are just sort of trying to maintain a status quo and their baseline has dropped significantly. So then, for some reason, the opiates aren't there anymore and the person dips into withdrawal. And that's often where we see them. Like we talked about our ambulatory withdrawal management, that's usually where they come into us, interested in starting medication. So, and then the rest of the process talks about relapse recovery process. So what we know is that addiction is chronic and relapsing, so it's likely, we try to avoid it if we can, but it's likely that relapse will happen, some sort of trigger happens, and then relapse happens, hopefully we can get them up to that baseline. So the goal of getting people on, especially medication-assisted treatment, is to help bring them back to that baseline without the use of illicit opiates, so that they can work on all the other things in life that they want in their recovery. So, and this is, like we talked about for opiate use disorder, this is really a mainstay of treatment and often is the